Integration. One small word, but one big imperative for healthcare organizations entering the electronic age. In an industry notorious for the proliferation of paper, using IT to cut costs and improve information sharing is a significant cultural shift, but one that can spark dramatic benefits. Let's visit the Detroit Medical Center to learn how integration is transforming a large, spread-out facility into a seamlessly functioning system. We'll meet some patients and observe their experiences for a personal look at how IT creates operational efficiencies and improves care quality. Detroit, Michigan, the birthplace of Henry Ford, the origin of the moving assembly line that revolutionized auto manufacturing, the source of that one-of-a-kind Motown sound, and the home of the Detroit Medical Center, a 2,000-bed organization with 3,000 affiliated physicians, a facility that discharged almost 100,000 patients and handled nearly 500,000 outpatient visits in the year 2000, a system with a solid bottom line. But that wasn't always the case. In 1998, the DMC was truly singing the blues. It lost $100 million that year and another $100 million the next. The health system needed to make changes and make them fast to survive. Dr. Don Reagan, CIO, knew that information technology was the key to unleashing dramatic operational improvements.
We were, as a medical center, challenged financially, primarily because of the changes in billing reimbursement, our academic situation, and the urban mission that we have to support the patient care of the indigent population in Detroit. We felt that we would need to deliver product more efficiently than hospitals that didn't have those challenges. We need to have one common application across our enterprise, so when it comes to charge capture or clinical research, having a common IS platform has brought us efficiencies which have allowed us to reduce or at least maintain staffing levels and still provide an enhanced product to our customers.
Let's meet two DMC patients. Through their experiences, we'll see how the use of IT improves patient satisfaction and realizes process efficiencies. The first patient is Mary Anderson. She's a 32-year-old businesswoman. The second is Joe Bennett. He's a 54-year-old EMT and firefighter. A fall down the stairs has brought Mary to the emergency department. During an exam of her arm, shoulder, and wrist, the attending physician detects a lump under her arm. Injuries from her fall prove no more serious than a sprain, but the lump must be investigated further. Using Cerner's FirstNet, the attending ED physician gains access to her patient's electronic medical record. She learns when Mary last had a mammogram and compares current x-rays to historical images.
This puts their historical cradle-to-grave document in one location. And for us to be able to get that information rapidly is extremely important. In life-threatening situations, it can make a huge difference in patient outcome.
Meanwhile, Joe is visiting his primary care physician for a routine checkup. After the exam, Joe's physician accesses his electronic medical record using Cerner's Power Chart Office. Compared to his last exam, Joe's prostate is slightly enlarged. A bit concerned, the doctor refers Joe to a specialist. The Power Chart Office electronic medical record system supports DMC physicians in providing accurate, timely, effective medical care.
What that allows us to do is to be able to search the database for our patients and their results. One of our biggest rewards so far has been the ability to have our test results, especially laboratory, pathology, and operative dictations. In the past, sometimes it took hours to get those reports. Now we get them in a second.
Although improvements have already been dramatic, Dr. Salison and the DMC team anticipate even greater achievements.
We certainly are looking forward to physician order entry. There are tremendous risks involved in terms of writing prescriptions. That kind of safety will be a serious improvement in quality of patient care.
Power Chart is just one example of the technological advances the DMC is making to work smarter and deliver better care.
They are now able to access information on a patient in a moment's notice. In addition, they can access it from their private offices. They can access information from home. They've become dependent on the access to information that was not available in the paper world.
In the emergency department, a mammogram is scheduled for Mary. Meanwhile, in his physician's office, a consultation with an oncologist is scheduled for Joe. Cerner's capstone scheduling is helping the DMC eliminate an entirely manual scheduling process in favor of an automated centralized solution. All radiology appointments, 800 to 1,000 each day, are now scheduled electronically. Mary arrives for her mammogram. The technologist who evaluates her already has Mary's prior hospital history, as well as complete records from her own physician's office. Meanwhile, Joe arrives for his consultation. Thanks to the completeness and accessibility of the electronic record, the specialist quickly gets up to speed on Joe's medical history. Today, access to PowerChart is available to caregivers from more than 2,500 PCs throughout all clinical and nursing areas. DMC providers place more than 65,000 order transactions spanning nutrition orders, lab tests, and patient orders each day.
Most physicians live pretty full professional lives trying to get their work done. A large portion of that effort is chasing down results and doing the logistics to support an upfront patient visit. It definitely is easier when you have an organized, patient-centric record.
In addition to patient satisfaction, the electronic medical record offers great opportunities to improve patient safety.
The electronic record, as it becomes more fully functional, will not simply be a passive, flat presentation of data as paper is. Instead, it will talk back and push back, particularly on issues of patient safety. We will have, within the year, automated physician order entry as well as an automated pharmacy. We already have a clinical repository of drug allergy data associated with patients. Those different previously isolated silos of data will talk to each other.
A technologist performs Mary's mammogram and records the results in Cerner RadNet. Meanwhile, Joe discovers more about the treatment options available to him, learning that early detection will improve his opportunity for a positive outcome. RadNet delivers diverse functionalities to improve radiology processes.
One of the biggest concerns of any referring physician is always the amount of time it takes to get a report. In the past, it was a hard copy report. This would take days to be able to get through because of the dictation, transcription, correction, finalization, mailing process, whatever. Once we went on with RadNet, this allowed us to turn a report around in 24 hours.
In addition to improving care delivery, RadNet has helped the DMC radiology department increase its operational efficiency.
Every time you automate something, you improve the quality, the accuracy, and the speed of your services. The efficiencies we gain through the automation allow us to increase the volumes of patients that we see without increasing the staff proportionally the way we have been doing so in the past.
The radiology results are electronically transmitted to Mary's and Joe's physicians, who can review the latest information in their own offices using PowerChart Office. Their doctors quickly order biopsies. After Mary's hospital admission, a nurse uses Cerner CareNet's patient outcome records to create a care plan.
We need to look at how we can maximize the workforce we have. Everyone in healthcare today knows that we're at a critical shortage. We're seeing our workforce decrease in numbers, and also they're increasing in their age. So what we can bring to the bedside to make giving patient care a satisfier not only for our patients but also for our nurses is very important.
Later, with Mary's biopsy complete and discovered to be negative, her surgeon accesses PowerChart from home to review Mary's status. She remotely authorizes Mary's discharge, avoiding costly delays in releasing her. Mary and Joe will receive follow-up care from their physicians who have access to current, updated information in their electronic medical records. The Cerner Detroit Medical Center relationship is one that is yielding positive returns. Streamlined workflow, greater efficiencies, timely decision-making. A variety of such improvements have been made possible because of a strong sense of teamwork between Cerner and the DMC.
The partnership with Cerner is important because that single application controls so much of our clinical service, charge capture, financial profitability or success. People now look to the Cerner product as a potential solution for many things that 2 years ago they would not have looked at computerization. They would have sought paper ways to communicate. Now the computer becomes the preferred route of communication.
Integration. One small word with many big benefits for the Detroit Medical Center. Excellent communications, dramatic process efficiencies, better care, and better business.